I am also I am also the Colorado Department of Public Health and Environment, STI HIV Public Health Detailer. My role sits within the Office of STI, HIV, and Viral Hepatitis, and I'm tasked with keeping Colorado clinicians current in their knowledge and care of all things sexually transmitted infections and HIV. Today, I'm going to talk with you about blood-borne pathogens, and we're going to put a focus on these pathogens within the correctional care setting. So exposure to blood and other body fluids occur across a wide variety of occupations. Healthcare workers, emergency response, and public safety personnel, like yourselves, and other workers can be exposed to blood through needle stick and other sharp injuries, mucous membranes, and skin exposures. The blood-borne pathogens of primary concern are the human immunodeficiency virus, commonly referred to as HIV, hepatitis B virus, and hepatitis C virus. So according to the U.S. Bureau of Justice Statistics, over 5 million people are estimated to be under the supervision of U.S. adult correctional systems, meaning that they are in prison or jail or on probation or parole. Many persons who are justice involved experience multiple risk factors for HIV, viral hepatitis, and sexually transmitted infections. Additionally, a high proportion of people with justice system involvement have a history of unstable housing, mental health, and substance use disorders, which actually increases vulnerability and risk for HIV, viral hepatitis, and STIs. The prevalence for these infections and disease among people who are incarcerated is also higher than it is for our general population. So today, we're going to focus on viral hepatitis and HIV, blood-borne pathogens that you may encounter in your role within the correctional care environment. However, more importantly, we're going to discuss steps that you can take to proactively protect yourself and others from exposure to these pathogens. All right, so just to go over some of my objectives and goals for you today, what we're going to do today is we're going to define blood-borne pathogens. We're going to explain the mode of transmission of these pathogens. I'm going to talk to you and describe the blood-borne pathogens that are commonly found within the correctional care setting. Again, hepatitis B, hepatitis C, and HIV. I'm going to talk to you about evaluating the risk of blood-borne pathogen exposure in your setting. We're going to talk about identifying next steps that you would take after blood-borne pathogen exposure. And then we're going to consider proactive steps that you can take to mitigate the risk of exposure to these pathogens. I wanted to point out down here at the bottom left, I have this nice little red circle with the CDPHE emblem in that. So throughout the slides, you're going to see that symbol pop up. And I want to let you know that once you receive the slide deck, if you click on those little circles, it is going to take you to additional information about the topic on the slide that you're looking at. This is a great way for you to help yourself to some additional information. And truth be told, I reviewed those resources prior to getting with you today. So I know that they're reliable academic or scholarly in nature. So they're reliable resources for you. All right. So let's go ahead and get started. So what is a blood-borne pathogen? Blood-borne pathogens are infectious microorganisms or pathogens in human blood that can cause disease. These pathogens include, but are not limited to, hepatitis B, hepatitis C, and HIV. Pathogens are spread through contact with blood or body fluids. And so I want to talk about what exactly is a body fluid. I get lots of questions on that. So bodily fluids or biofluids include saliva, tears, nasal discharge or mucus, commonly referred to, I think, by most people as snot, right? It can be phlegm, blood, drainage from wounds, urine, feces or diarrhea, semen or vaginal fluid, amniotic fluid, cerebral spinal fluid. And I'm not sure if I've missed anything, but that gives you a lot to work with and consider what actually constitutes a body fluid. Next, let's talk about modes of transmission for these pathogens. So the modes of transmission include exposure to someone's blood, sexual contact, or infected mothers, giving that virus or that pathogen to their child during pregnancy or delivery. So taking a look at exposure to another person's blood, how this can happen. So this can be through a contaminated needle or needle sharing or sharing drug injection equipment. This can happen through needle sticks. So imagine in your medical area, in your facility, where you might be taking blood from somebody for a lab test. Those are the type of needle sticks that I'm referring to. An exposure can happen through contaminated sharps or glass. So imagine if you're in a situation where there's broken glass and someone cuts themselves on that, that gives a blood exposure. Blood contact with non-intact skin or mucous membranes. And an example of a mucous membrane is the lining of your nose. Barrier-free contact with blood or other body fluids. And then poor infection control in congregate settings or facilities. In regard to sexual contact, I'm referring to barrier-free contact with blood or body fluids. Condomless intercourse is a great example of what I'm meaning here. And again, that would be exposure to semen and vaginal secretions. And then again, as I mentioned, infection between mother and child. That's referred to as perinatal transmission, and that can happen during pregnancy or delivery. So we're going to, again, focus on 3 common blood-borne pathogens seen in correctional care settings as well as healthcare settings. And these, again, are the pathogens of primary concern: HIV, hepatitis B, and hepatitis C virus. So let's take a closer look at each one of these. I'm going to start by reviewing what exactly is hepatitis. What does that mean? So hepatitis means inflammation of the liver. When the liver is inflamed or damaged, its function can be dramatically affected. Things such as heavy alcohol use, toxins, some medications, and certain medical conditions can all cause hepatitis. However, hepatitis is often caused by a virus, which is what we're going to cover today. So in the United States, hepatitis B virus and hepatitis C virus are 2 of the most common hepatitis viruses. Hepatitis B and hepatitis C are liver infections caused by 2 separate viruses. And although each of these can cause similar symptoms, they are spread in different ways and can affect the liver differently. So infection with either of these viruses can begin as a short-term infection. However, in some people, the virus will remain within the body and cause chronic long-term infections. And those infections can also be lifelong. We're going to talk further about that as we go along here. We're going to start, however, by focusing on hepatitis B. So what is it, right? So hepatitis B is a vaccine-preventable liver infection caused by the hepatitis B virus, or HBV. The virus can cause lifelong infection, cirrhosis or scarring of the liver, liver cancer, liver failure, and even death. Hepatitis B is the leading cause of liver cancer. About 2 in 3 people with hepatitis B do not know that they are infected. Hepatitis B is spread when blood, semen, or other body fluids from a person infected with the virus enters the body of someone who's not infected. And this can happen through unprotected contact with blood or body fluids, including direct contact with the blood or open sores of a person who has hepatitis B, sexual contact, so sex with a partner who has hepatitis B, sharing contaminated needles, syringes, or other drug injection equipment, sharing contaminated items such as toothbrushes, razors, or medical equipment. And an example of medical equipment could be something like a glucose monitor, and sharing those items with a person who has that virus. Hepatitis B can be spread during pregnancy or delivery, and hepatitis B is also spread in situations of poor infection control in congregate settings. Although the hepatitis B virus can be found in saliva, it is not spread through kissing or sharing utensils. Hepatitis B is also not spread through sneezing, coughing, hugging someone, breastfeeding, or through food or water. Something I did want to point out, though, is that hepatitis B can remain infectious on surfaces for up to 7 days. So the use of cleaning products that are identified as cytotoxic to hepatitis B should be used for any blood or body fluid cleanups. In 2020, a total of 2,157 cases of acute or short-term hepatitis B were reported to the CDC. And I just want to point out that this is national data. As we go forward, I'm going to be sharing with you national data as well as local Colorado state data, and I'll tell you the difference as we go along. However, since many people may not have symptoms or don't know that they're infected, their illness is often not diagnosed, so it isn't reported or counted. So do keep that in mind as we go along with some of these statistics. And with that, the CDC estimates that the actual number of acute hepatitis B cases was closer to 14,000 in 2020. I also want to let you know that recently the Centers for Disease Control has released an updated report. So there are actually newer data sets than what I'm using today. However, that just happened within the last few weeks. So we're going to go with the numbers that I had prior to the release of that report. Okay, so the CDC estimates that approximately about 880,000 adults are living with chronic hepatitis B virus. So I'm also going to be completely transparent with you that there really isn't a lot of data available surrounding disease prevalence within the correctional care setting, or should I say at least not current information. And by that, I mean within the last 5 years. So with that in mind, as we go forward, I'm going to give you some statistics that I'd like to share with you regarding hepatitis B and the correctional care setting. So in 2009, a systematic review of 23 studies from incarcerated populations in the United States reported a wide chronic hepatitis B virus prevalence range of about 11%, so 1 to about 11%. This HBV or hepatitis B virus prevalence has been estimated to be 3 to 38 times higher in correctional care settings than in the general population. In 2016, 1.2% of persons in state and federal prisons had tested positive for hepatitis B. So of note, the 2016 data I just provided was published by the Bureau of Justice Statistics in June of 2021. So these data are fairly recent and put out by that department. So we're going to talk more about some of the findings from that 2016 data set as we move forward as well. So there is no cure for hepatitis B. However, it can be controlled with daily medication. The good news, though, is that there's highly effective vaccines that are available for people at risk of infection, and this is the best way to prevent hepatitis B. In regard to the vaccination guidelines, all adults aged 18 to 59 should receive the vaccine, and any adult who requests the vaccine should be able to receive that. All adults 18 years and older should be screened at least once in their lifetime for the hepatitis B virus. And really what you can do is talk with your healthcare provider or your local health department about getting vaccinated. Some clinics offer free or low-cost hepatitis B vaccines. And my thought would be, as correctional care setting employees, most likely you have means of getting that vaccine, through your employer. So that would be something to look into. All right, let's turn our attentions to the hepatitis C virus, or HCV. Hepatitis C is a liver infection that's caused by the hepatitis C virus. Hepatitis C is the leading cause of liver transplants and liver cancer, in the United States. Hepatitis C is spread through contact with blood from an infected person, and today, most people become infected with hepatitis C by sharing needles or other equipment used to prepare or inject drugs. Nearly 40% of people with hepatitis C don't know they're infected. So possible exposures to the hepatitis C virus, again, include injection drug use, and this is currently the most common mode of transmission of this virus in the United States. Again, birth to an HCV-infected mother, so a mother to child or perinatal transmission. And although less frequent, hepatitis C virus can also be spread through sharing personal items contaminated with infectious blood, such as razors or toothbrushes, so not unlike hepatitis B. Hepatitis C can be spread through healthcare procedures that involve invasive procedures, such as injections, and that's usually recognized in the context of an outbreak. Unregulated tattooing is a known source for transmitting the hepatitis C virus, and needle stick injuries in healthcare and congregate settings. And then, although rare, transmission can occur via sex with an HCV-infected person. It's an ineffective means of transmission, although HIV-infected men who have sex with men, or MSM, have increased risk of sexual transmission. The hepatitis C virus may also remain infectious on surfaces for up to 6 weeks. So again, ensuring that blood or bodily fluid cleanup includes products that are cytotoxic to the hepatitis C virus is really important. And just to throw this out there, if you actually look at the bottle of whatever product you're using, it will actually list on there if it is cytotoxic to certain viruses. So in 2020, the CDC estimated that there were over 66,000 new HCV infections in the United States. The CDC also estimated that between 2013 to 2016, 2.4 million people in the United States were living with hepatitis C. And again, most folks were completely unaware they had that virus. During that same time period, so 2013 to 2016, people who were incarcerated were estimated to have a rate of current hepatitis C infection 10 times higher than persons in the general population. In 2016, approximately 9% of persons in state and federal prisons had the hepatitis C virus. Approximately 30% of all persons infected with hepatitis C virus in the United States spend at least part of the year in a correctional facility, so in or out of prisons or jails. So is hepatitis C virus curable? Once upon a time, no, but the answer now to that question is actually yes. Hepatitis C virus can be treated with a medication that is taken orally once daily with food, and the length of treatment is 8, 12, or 16 weeks, and that depends on a couple of things, including the virus genotype, previous hepatitis C treatment, or having compensated cirrhosis. So, an evaluation would be needed to determine the best course. I want to point out, though, that there is no vaccine against hepatitis C virus. So the best way to prevent hepatitis C is by avoiding behaviors that can spread the disease, especially injecting drugs. So next I wanted to talk to you about what does hepatitis actually look like? What would somebody look like that has become infected with this virus, either of these viruses? So people with newly acquired or acute hepatitis C or hepatitis B virus infection usually are asymptomatic, meaning they don't really show that they have symptoms, or they have symptoms that are so mild that they're unlikely to prompt a visit to a healthcare professional. However, up to half of all older children, adolescents, and adults experience symptoms related to acute hepatitis B infection. When symptoms do occur with either of these viruses, they're going to usually include fever, fatigue, dark-colored urine, clay-colored stool, complaints of abdominal pain, loss of appetite, nausea, vomiting, joint pain, or jaundice. And jaundice refers to a yellow color in the skin or in the eyes. And you can see that depicted in that little animation there on the left. So what are the symptoms of chronic or long-term hepatitis B? Most people with chronic hepatitis B, again, don't have any symptoms. They don't feel ill, and they oftentimes remain symptom-free for decades. And when and if symptoms do appear, they're like the symptoms of a new infection, so that list that we just reviewed. But they can also be a sign of advanced liver disease by that time. People who test positive for acute hepatitis B are usually treated through supportive care. So that would be rest, adequate nutrition, fluids, to really help relieve the symptoms that the virus causes. People with chronic hepatitis B can be treated with antiviral drugs and should be monitored regularly for signs of liver disease progression. Chronic hepatitis B can develop into a serious disease resulting in long-term health problems, and that can include liver damage, liver failure, liver cancer, and even death. So there were 1,752 deaths related to hepatitis B virus, reported to the CDC in 2020. So let's talk about what the signs and symptoms of chronic hepatitis C infection look like. So most people with chronic hepatitis C infection are asymptomatic or have nonspecific symptoms such as chronic fatigue and depression. About half of adults who get infected with hepatitis C virus develop a chronic infection from that virus. And many eventually develop chronic liver disease, which can range from mild to severe. And again, that can include cirrhosis of the liver and liver cancer. Chronic liver disease in hepatitis C virus infected people is usually insidious. So it progresses slowly without any signs or symptoms for several decades. And in fact, HCV or hepatitis C virus infection is often not recognized until asymptomatic people are identified as being positive when they're screened for things like blood donation, or when they're actually having a routine health exam where their provider tests their liver enzymes. And when those tests come back, those liver enzymes are elevated. And that is what prompts that provider to look a little bit further to see what's causing those elevations and then subsequently testing for the virus. So talking about burden on Colorado communities, I want to talk to you a little bit about the 2021 Colorado data snapshot of this. So now that we have a better understanding of acute versus chronic hepatitis, I'd like to circle back to that burden of hepatitis B virus and hepatitis C virus in our communities. However, this time, again, we're going to take a look at the burden of these two viruses directly on our Colorado communities. And we're going to do that by taking a look at the available 2021 data. There were a total of 1,998 confirmed cases of hepatitis B and C reported to CDPHE, the Colorado Department of Public Health and Environment, in 2021. From 2017 to 2021, there were a cumulative 14,523 reported cases of hepatitis B and hepatitis C. 95% of those were chronic conditions. In regard to acute hepatitis B virus, over the past 5 years, there have been 90 cases of acute hepatitis B virus in Colorado. From 2017 to 2021, males accounted for approximately 69% of all acute hepatitis B virus diagnoses. 40 to 59-year-olds have experienced the highest rates of acute hepatitis B diagnosis over the past 5 years within the state of Colorado. From 2017 to 2021, 17% of acute hepatitis B virus cases reported experiencing homelessness at the time of their diagnoses, and 20% of the acute hepatitis B diagnoses reported injection drug use as a behavioral risk factor. 88% of acute HBV over the past 5 years have occurred in urban counties, which include Adams County, Arapahoe County, Boulder, Broomfield, Denver, Douglas, El Paso, Jefferson, Larimer, Mesa, Pueblo, and Weld counties. And with that, 61% occurred in the Denver greater metro area. There were 0 perinatal or mother-to-child transmissions of hepatitis B cases in 2021 in Colorado. And in Colorado, the hepatitis B birth dose vaccination rate was about 84% in 2021. And what that means is that when babies are born here in the state of Colorado, and most states, of course, in the United States, they're actually started on the hepatitis B vaccine series as a way to control that spread of hepatitis B and to protect our most precious young Coloradans as they grow through life. In regard to chronic hepatitis B virus, in 2021, there were 239 reported cases of chronic hepatitis B virus here in Colorado. This is a 17% increase from the diagnoses that were reported to CDPHE in 2020. Over half of the cases reported from 2017 to 2021 were among males, and the highest proportion of cases occurred in 20 to 39-year-olds. 66% of the cases occurred in the greater Denver metro area. So chronic hepatitis B diagnoses over the past 5 years, so 2017 to 2021, have been concentrated largely in Arapahoe, Denver, and El Paso counties. In 2021, over a fifth of cases occurred in Arapahoe County, followed by Denver and then Adams. Taking a look at hepatitis C in Colorado now. So in Colorado in 2021, the majority of both acute and chronic cases of hepatitis C occurred in people aged 20 to 39. Rising rate of cases among 20 to 39-year-olds in Colorado and nationally actually mirror the national trends related to the opioid epidemic. Focusing on acute hepatitis C, in 2021, there were 4 cases of acute hepatitis C virus reported to CDPHE. And from 2017 to 2021, about 55% of cases of acute hepatitis C occurred again in our Denver metro area. The majority of those diagnoses over that past 5-year period occurred in Denver, El Paso, Adams, and Arapahoe counties. And during that same time period, again, 2017 to 2021, 11% of acute hepatitis C virus cases were diagnosed in our state and federal prisons. In 2019, rates of acute hepatitis C virus among males were approximately 162% higher than females. The majority of cases of acute hepatitis C virus between 2017 and 2021 were among people that were 20 to 39 years old. The majority of the diagnoses were also among non-Hispanic whites, and that was about 67% of the cases. The primary behavioral risk factor reported, again, was injection drug use. Also, over that same 5-year period, 17% of the acute HCV or hepatitis C diagnoses were among people experiencing homelessness, and 11% were incarcerated in a state or federal prison at the time that they were diagnosed. So taking a look at chronic hepatitis C, in 2021, there were 1,752 cases of chronic hepatitis C reported in the state of Colorado. 69% of those diagnoses in 2021 were among males. Also in 2021, 20 to 39-year-olds were disproportionately affected by chronic hepatitis C and made up approximately 45% of the diagnoses. 20 to 39-year-olds only made up about 20% of the overall population of Colorado, but accounted for 45% of the chronic hepatitis C diagnoses. So that's a big disparity within that group. And again, the rising rates of cases among the 20 to 39-year-olds in Colorado mirror national trends related to the opioid epidemic. In 2021, about 40% of cases of chronic HCV or chronic hepatitis C virus occurred in the Denver metro area. However, from 2017 to 2021, more diagnoses of chronic hepatitis C virus occurred in our federal and state prisons than any county in Colorado. So by that, I mean, we had more positive cases reported within our federal and state prisons than any county in our state. Cases among incarcerated individuals actually represented 22% of all reported cases between 2017 and 2021, which was higher again than any individual county. In 2021 specifically, about 19% of all cases occurred in prisons. I know this is a lot of statistics, and I'm going to give you just a little bit more because I want to give you some specifics that come from the Colorado Department of Corrections. So in 2018, the Colorado Department of Corrections actually committed $41 million over a 2-year period to treat incarcerated populations who were living with chronic hepatitis C virus. This commitment actually included the Colorado Department of Corrections offering hepatitis C virus testing to inmates upon intake into prison. Since 2017, there have been 2,686 chronic hepatitis C cases reported to CDPHE from prisons, and that represents about 22% of all chronic hepatitis C cases in Colorado during that time period. In the fiscal year July 2020 to June 2021, 190 offenders had completed treatment and had sustained virologic response, and 44 were released mid-treatment. In 2022 fiscal year, 127 offenders had completed treatment and had sustained that virologic response, and 27 were released mid-treatment. But by the end of the 2022 fiscal year, 1,226 offenders had been successfully treated for chronic hepatitis C, and 1,226 had finished treatment and sustained viral suppression. So that is definitely a success story for the Department of Corrections here within our state. All right, so let's talk about who's at risk for hepatitis B, and then we'll talk about who's at risk for hepatitis C. So although anybody can get hepatitis B, there are some populations who are at greater risk. And this includes infants born to mothers with hepatitis B, people born in certain countries where hepatitis B is common, people born in the United States and not vaccinated as infants, people with hepatitis C virus are at higher risk of acquiring hepatitis B virus, people who are incarcerated, people experiencing housing needs, people who inject drugs or share needles, syringes, or other types of drug equipment, people who have sex partners that have hepatitis B, and people who have sexually transmitted infections are at higher risk. And let's just talk about people with HIV for just a moment. About 2% of people with HIV in the United States are co-infected with hepatitis B virus, which means both infections have similar routes of transmission. Another population at risk, men who have sex with men, people who live with somebody who has hepatitis B, and that does include correctional care or congregate house settings. People who are on dialysis, people who have elevated levels of certain liver enzymes, and healthcare and public safety workers exposed to blood on the job. And that includes all of you. So folks who are at a higher risk for hepatitis C infection. And again, although anyone can get hepatitis C, these populations are at a greater risk of acquiring hepatitis C. So children born to moms with hepatitis C, people with HIV infection, hepatitis C virus infection is common among people with HIV who also inject drugs. Nearly 75% of people living with HIV who report a history of injection drug use are co-infected with hepatitis C virus. Current or former people who use injection drugs, including those who injected only once many years ago, because hepatitis C virus is primarily spread through contact with infected blood. People who inject drugs are at an increased risk for the virus, even if they only injected one time. People with selected medical conditions, and this includes those who maybe have received hemodialysis. People who have received blood transfusions or organ transplants, including people who received clotting factors before 1987. Healthcare, emergency medical, public health safety personnel after needle stick sharps or mucosal exposures to hepatitis C virus positive blood. Again, this includes all of you. Okay, next let's talk about HIV. So what is HIV? HIV is a retrovirus that attacks the body's immune system. This virus disables the body's immune system until it's no longer capable of fighting infection. And if HIV is not treated, it can lead to acquired immunodeficiency syndrome, commonly known as AIDS. HIV is transmitted through unprotected contact with blood or other bodily fluids that are infected with the virus, and this includes condomless sex. There were over 32,000 estimated new HIV infections in the United States in 2021. And gay, bisexual, or other men who reported engaging in male-to-male sexual contact accounted for 70% of the 32,100 estimated new infections and 86% of estimated infections among all men. Heterosexual contact accounted for 22% of those estimated new infections. People who inject drugs accounted for 8% of the 32,100 estimated new infections. And in 2021, 1.1% of persons incarcerated in state and federal prisons were positive for HIV. And 1.1% seems like a small number, I get that, but I want to point out that this rate is actually 3 times higher than the prevalence in the general US population. So in regard to the burden on our Colorado communities, we had a cumulative 21,621 cases of HIV that have been reported in Colorado since 1982. And an estimated 14,832 people were living with HIV in Colorado through the end of 2020. In 2020, Colorado saw 324 newly diagnosed HIV cases. And of those, 282 were male and 42 were female. Of the total number of people diagnosed with HIV in 2020, 46% were non-Hispanic white, 32% were Hispanic Latinx, and about 19% were non-Hispanic Black African Americans. And I point this out because non-Hispanic Black African Americans and Hispanic Latinx of all races continue to be disproportionately affected by HIV. So there is currently no effective cure for HIV. Once somebody gets HIV, they have it for life. However, with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives and protect their partners. So let's talk about what HIV looks like. Once a person becomes immunocompromised, he or she can exhibit symptoms of weight loss, persistent low-grade fever, night sweats, and flu-like symptoms. During this time, this person is also more vulnerable to pneumonias, intestinal disorders, and fungal infections. When people with HIV don't get treatment, they typically progress through 3 distinct stages. However, again, HIV treatment can slow or prevent progression of the disease. Let's talk about what each of these stages of infection look like. So stage 1 is acute HIV infection. And most people have flu-like symptoms within 2 to 4 weeks after infection. However, some people don't have symptoms at all. The important thing to know, though, is that during this time, people have a large amount of HIV in their blood and they are very contagious. It's also important to point out that having these symptoms alone doesn't mean you have HIV. Other illnesses can cause similar symptoms. So the only way to really know if it's HIV is to get tested. I also want to point out that approximately 1 in 7 people don't know they have HIV because they haven't been tested. And this can mean that both the patient or the inmate and the sheriff or deputy or healthcare worker are actually unaware of the potential exposure or risk one another might present. So, bottom line is if you have flu-like symptoms and you think you've been exposed, you want to get tested. So, taking a look at stage 2. Stage 2 is chronic infection, and this stage is also called asymptomatic HIV infection or clinical latency. HIV is still active and continues to reproduce in the body, and people may not have symptoms or get sick during this phase, but again, can still transmit HIV. People who take HIV treatment or antiretroviral therapy as prescribed may never move into stage 3, also referred to as AIDS. Antiretroviral therapy, or ART, reduces the amount of HIV in the body or the viral load to a very low level. And this helps keep the immune system working and prevents illness. This is also referred to as viral suppression. ART can even make the viral load so low that a test can't detect HIV anymore. This is called an undetectable viral load. And a benefit of that is that in reducing the amount of virus in the body, it prevents transmission to others through sex or syringe needle sharing. And it also reduces transmission from mother to child during pregnancy, birth, and breastfeeding. And you might hear this referred to often as treatment as prevention or U equals U. However, without HIV treatment, stage 2 may last a decade or longer, and it may progress faster. So at the end of this stage, the amount of HIV in the blood, if untreated, goes up, and the person may move into stage 3, which is acquired immune deficiency syndrome, or AIDS. And that, of course, is the most severe stage of HIV infection. People with AIDS have badly damaged immune systems, and they can get increasing number of opportunistic infections or other serious illnesses. And without HIV treatment, people with AIDS typically survive about 3 years. So I'm looking at the clock, so let's quickly go through who's at risk for HIV. Folks who are at risk for HIV is actually it's mainly spread by having sex or sharing syringes or other injection equipment with someone who's been infected. Substance use can contribute to the risk indirectly because alcohol or other drugs can lower people's inhibitions and make them less likely to use condoms. Anyone can contract HIV. Anyone can acquire HIV. And while people who inject drugs are at a greater risk because of practices related to their injection drug use, anyone who engages in unsafe sex, meaning unprotected sex with an infected partner, could be exposed to the infection. Again, there are groups who are more affected by HIV than others. They're more vulnerable to infection. This includes gay, bisexual, and other men who have sex with men, Black, Latino, and American Indian Native men, Black women. Black women are largely affected by HIV currently in the United States. Transgender women, youth aged 13 to 24, and again, people who inject drugs, and people with a history of sexually transmitted infections. Folks with a history of other sexually transmitted infections are actually at a greater risk of HIV because the effects that the STI they already have has on the body. And if you join me next month for our discussion on STIs, we're going to talk further about that and that connection, which I think is rather fascinating. So what's your risk? How can a correctional care worker be exposed to blood-borne pathogens on the job? I talked to a few people who work in correctional care settings, and I came up with a list that is not all inclusive. However, needle sticks or cuts from used needles or other sharps, contact of your eyes, nose, mouth, or broken skin with blood, assaults, being bitten, cuts, or knife wounds that might happen when you're on the job. Splashes of blood or bodily fluids or punctures to the skin from bites. Those can cause a route of exposure. And then environmental situations that require blood or bodily fluid cleanup. So what are some steps that you can take to mitigate these risks? Protect yourself. Search safely. Always wear gloves. Look before you reach. Never run fingers under surfaces that you cannot see. And using common sense and best practices for pat downs or other inspections. So what should you do if you're exposed? First, you're going to want to wash needle sticks and cuts with soap and water. Flush splashes to the nose, mouth, or skin with water. Irrigate your eyes with clean water, saline, or sterile wash. And make sure that you're reporting all exposures promptly to ensure that you receive appropriate follow-up care. Prompt reporting is really essential because in some cases, post-exposure treatment may be recommended and should be started as soon as possible. And what I mean by this is exposure to HIV, HIV PrEP or PEP. If you're exposed to HIV at work, report that exposure to the appropriate person and see a doctor or visit an emergency room right away. Post-exposure prophylactics, including PEP, PEP, provides anti-HIV medications to someone who has had a substantial exposure, and that's usually to blood. PEP can reduce your chances of getting HIV infected. However, it must be started within 72 hours or 3 days after that exposure. So the sooner you start PEP, the better. And PEP has been the standard of care for occupationally exposed healthcare workers or correctional care facility workers since 1996. So mitigating your risk. To mitigate the risk of exposure to bloodborne pathogens, facilities should consider the development and implementation of a bloodborne pathogens exposure control plan if one's not already in place. And there are some elements to these plans that should be included, such as universal and standard precautions, post-exposure incident investigation procedures, and a SHARPS injury log. It should also take a look at engineering controls, such as the use of SHARPS containers, puncture-resistant plastics, metals, biohazard waste bags and containers, and safety-engineered SHARPS devices, such as retractable needles. It should also look at housekeeping and waste procedures, and we talked a little bit about that in regard to cleaning supplies that you can use to help decrease the chance of exposure when picking or cleaning things up. And then also the use of personal protective equipment or PPE. That includes gloves, gowns, face protection, goggles, and also the training education of the staff. But another important thing I want to point out is that this plan should really take into consideration being developed by the actual folks who are doing those jobs, the actual folks who are at that risk, because you know what your exposure risk is. You know what you run into when you're on the job. So helping and being a part of implementing those sort of exposure plans is really essential for employee involvement. Also, receiving the hepatitis B vaccination. We talked about that a little bit already. In the interest of time, I'm going to encourage you to click on that little circle when you get the slide deck so that you can further take a look at what that vaccination is about. Next, hand hygiene. Hand hygiene is super important in mitigating your risk to bloodborne pathogens. Again, I'm going to let you click on that little circle there to get some additional information about hand hygiene. However, a couple of things that I do want to point out before we move past this. I was the director of infection prevention during COVID at a facility. And one thing that I noticed was a lot of the employees had a belief that if they put on latex gloves and they just continue to wear those latex gloves all day long, that they were protecting themselves. I want to let you guys know that that is so not the case. Wearing what I like to refer to as magic gloves because they magically somehow protect you. That actually hinders you more than it helps. And the reason for that is while your hands are continuously in these gloves, the latex or non-latex gloves causes your hands to sweat. And what this does is it actually increases skin breakdown and micro tears on your dermal layer, your skin surface. And this thereby increases your chances of exposure to a bloodborne pathogen because it actually now provides a portal of entry. Additionally, wearing gloves continuously in lieu of washing your hands increases your chances of auto-inoculation of other pathogens that can make you sick. This includes the flu, COVID, and other things like the common cold. And when I say auto-inoculation, that means that you're touching maybe, I don't know, you're pushing your glasses up. You wear glasses and you use maybe your thumb or finger there to push your glasses up. Well, those gloves that you've had on are contaminated, and you just contaminated your glasses, which is close to your nose, which helps you have opportunity to become ill. All right. And then again, mitigating your risk to pathogens by use of universal and standard precautions and personal protective equipment. Standard precautions is an outgrowth of universal precautions. And basically the bottom line here is assume everything you come in contact with is infectious and treat it as such. All right. So I'm going to end there. I wanted to provide time for any questions that might come up. And please feel free to come off mute and let me know anything that you might need some clarity on. Also, if you take a look at this slide, you can see my contact information, and I welcome and encourage you to reach out to me and let me know your questions. And I would love to discuss further with you ways that you can protect yourself. You're definitely important. We need you in that job you're doing. But more importantly, you're important to your family and the people you go home to. So protecting yourself also means that you're protecting your loved ones. So I just wanted to point that out. All right. So at this time, please, again, feel free to come off mute. If you have questions, just let me know. Let me know.
Awesome. Thank you so much, Rachelle. That was really, really good. And if anybody has any questions, please feel free to either put it in the chat or unmute yourself. But if not, thank you so much for coming. I'll leave a couple seconds just in case anybody has anything. But again, thank you for your time today. And again, thank you so much, Rachelle. That was great.
Awesome. Thank you. And again, I look forward to coming back and revisiting you all next month. And we're going to talk about sexually transmitted infections. So it kind of is going to pick up where we left off here today. So
wonderful. Thank you so much.
My pleasure. Thank you for having me.